welcome back to my channel. Today we are going to be discussing an interesting topic. I've been getting questions like, did you use fertility drugs? Are you a twin? Does twin run in your family? These are some of the questions I've been getting since the birth of my twin boys. So today I am going to be talking about how I conceived my boys naturally 4 months after my marriage. Okay, so shortly after my marriage, we decided it was time for us to begin to have babies. I loved twins, and same with my husband. But we were not so focused on trying for twins actually. We're just trying for any baby, whether 1 or 2 or 3 or even 10. So, after some months, say in August of 2017, I tested positive. But one thing that's very special about that pregnancy was the positive test result came out so early. Like not so long after I completed my cycle, I got a positive. And then, even before I got that positive result, I was already having some of the symptoms of morning sickness. I lost my appetite. Like I just the sight of food irritates me. That was what prompted me to taking the test. And when I took the test, it was positive at a very early stage. So okay, I didn't know it was twin at the time. So I was just happy. We were happy. Okay, we were pregnant, and then life continued. At some point, I had a very nasty nasal congestion. And then after some time, we decided, okay, let's do a scan and then ascertain what is really going on in there. So when we got to the scan center, the first diagnosis that was made was twins, query triplets, because the sonographer said he could see a third sac. So we decided to repeat the scan again after some days in a different center, and it was confirmed that we were having twins. Okay, so some of the factors that are responsible for conception of twins or other multiples are, the first one is hyperovulation. This is a situation whereby a woman ovulates more than once in a cycle. In this situation, the ovary can release more than a single egg, or both ovaries can release eggs in a single cycle. And when there is sperm available for fertilization, it can result to twins or triplets or even more. In my case, I actually ovulated more than once in that cycle. That's because my twins are fraternal. They had 2 placenta, which means it was not a single egg that divided. It was 2 eggs that were fertilized by 2 different sperm and then resulting to their conception. So when a woman ovulates like that, she can have more than a single baby. That is if she is actively trying at the time and there's a presence of sperm. But in a situation where the person is not trying at the time, that cycle can just pass without being noticed. Okay, so the second one is gene. So for those that have twins in their family, the possibility of conceiving twins is higher, especially when the woman herself is a twin. So in that situation, the possibility of such individuals conceiving twins is higher than those who do not have the history of twins in their family at all. The next one we're going to be looking at is use of fertility drugs. So most of the fertility drugs that are used help in the stimulation of the ovary for release of egg. So sometimes when these drugs are used, they hyperstimulate the ovary, and so more than 1 egg can be released at a time. And when these eggs are fertilized, they can result to twins or triplets or other multiple babies. The next one we're looking at is IVF. IVF means in vitro fertilization. This is a fertilization that takes place outside the body of an individual. In this case, the woman's egg and the husband's sperm is fertilized in a laboratory dish, and then the embryos are transferred into the uterus, where they implant on the uterus, where they attach to the uterus lining to develop. Usually more than a single embryo is transferred, and when these embryos all survive, it can result to twins or triplets or other multiple babies. So that is the principle of in vitro fertilization. The next one is age. Women above the age of 30 have more chances of giving birth to twins or other multiples compared to women below that age. This is because the action of the follicle stimulating hormone FSH is higher at that age. So with the increase in the action of follicle stimulating hormone, it means ovulation is also heightened. So the release of eggs can also be increased, which can result to multiple babies, twins, triplets, or even more. And so the next one is height. So women who are taller have more chances of getting pregnant with multiples compared to women who are not so tall. I am not so tall. I guess I am an exception. Okay, so those are some of the factors that are responsible for conception of multiple babies. You're still here. Thank you so much for watching this video. I hope you enjoyed every of the factors that were listed. Kindly subscribe to this channel if you're yet to do so, and turn on your notification bell to keep getting our updates. See you in my next video. Bye.